Okay, fine. Now it's fine. All of you. Is it fine now? Is it fine now? Are you able to see my screen? Are you able to see my screen? Yeah, okay, chalo, fine. ठीक है, ठीक, all right, all right. Okay, now I can see this. ठीक है, चलो, all right. See, तो देखो यहाँ पे. So, okay, now you remember here, when I talk about the lead poisoning, see, this is going to destroy myelin sheet also, na? So, myelination problem. I know, so there can be encephalopathy, and there will be what? So, there will be encephalopathy, and after that, there can be what? See here, so there can be lead palsy. Among adults, there will be lead palsy, radial palsy, like there will be a foot drop, wrist drop, okay? There can be deposition of lead in bones also, so lead osteopathy. So, most important poisoning is what? Arsenic, mercury, and lead. Itna yaad rakho. Next question, see this one. In which poisoning you will see green color of urine, okay? Carbolic acid. See, in which poisoning you will see this one? Carbolic acid, okay? Carbolic acid of what? Phenol, right now? Phenol poisoning, no? Phenol poisoning, right? Remember here, see here, when I talk about, gastric lavage. When I talk about gastric lavage, remember gastric lavage is contraindicated in all acidic alkali poison except carbolic acid or phenol. Remember here, gastric lavage can be performed. Gastric lavage can be performed. Yaad rahega? Gastric lavage can be performed. Now a snake bite case, very, very important. A snake bite case, batao kya hai snake bite case? Yes. So always remember, see, a snake bite, very, very important. Every time directly you are not going to start the anti-snake venom. First of all, do understand some, like some points related to a snake bite. See here, first of all, remember, I am talking about neurotoxic snakes, cobra and rat. Which family? 𝗲𝗵𝗵𝗺. Hemotoxic and vasculotoxic, blood related, okay? Viper. Myotoxic, muscle cell injury, right now. So remember here, when I talk about 𝗲𝗵𝗵𝗺, cobra and rat, neurotoxic, no person will die because of respiratory failure. Myotoxic also finally respiratory failure. But when I talk about blood toxic, no person will die because of cardiac attack, cardiac arrest. Remember this part? Okay, fine. So when I talk about cobra and rat, these are neurotoxic. Symptoms will be neurological. Viper symptoms will be related to DIC, disseminated intravascular coagulation, and see a snake, severe body pain will be there. Okay, remember all this point. Remember, so they can ask you some image-based question. See here, out of these, most dangerous is this one. This is most dangerous, most lethal. Why it is most dangerous? Remember here, first of all, see, whenever there'll be poisonous snake, no poisonous snake, right? Whenever there will be poisonous snake, okay, after the snake bite, you can understand that there will be how many puncture marks? 2 puncture marks. 2 puncture marks will be there. 2 puncture marks. 2 puncture marks. 2 marks. So there will be the 2 fang marks, right? 2 fang marks. See, remember, in all poisonous snake, you can see 2 fang marks except in this one. Okay. Mostly no local symptoms, no bleeding, right? No bleeding, no local symptoms. Ideally, after a snake bite, there should be local symptoms. No, there'll be bleeding, there'll be pain, there'll be swelling, there can be, myonecrosis, there can be, swelling and all. Right now, fine. No, but in this snake, mostly no local symptoms. Okay, fine. So that's why it is, like after a snake bite, like this will be very, very late for the patient also to understand something has happened to him. When, respiratory problem will start, when there will be, whenever there will be paralytic problem, no, like neurotoxic symptoms will appear, no. After that, he will be shifted to hospital. Even if there will be no puncture marks, even it will be late for doctor to understand whether this was a snake case, right now. So it is very dangerous. Viper, where you can see shape like, shape like diamond shape. This is a viper. There will be confusion in king cobra, common cobra. See, you can see here over the head. Like you can see there is shape like the 2 specks. Remember, only a common man or only the common people will be wearing specs every time. A king does not need spectacles like that. So remember like this. So on the basis of this and a bispectacled head, remember here, only among the common cobra. King does not need specs. Remember all these points. Now the question is, how do you help? How do you do a snake bite? How do you manage a snake bite case? My question is, are you going to apply a tight tourniquet? No. Are you going to give incision and drainage or a suction? No. Are you going to wash with soap water? Wash with soap water. No, don't touch the wound. Don't touch the wound. Don't rub it because you can spread the venom. No coffee, no alcohol, no, no any electrical equipment there. Fine, no tight tourniquet, no suction, no incision drainage. Fine. So how do you treat a snake bite? How do you treat a snake bite? How do you treat a snake bite? Yes, you are going to treat, first of all, most important thing is that, yes, anti-snake venom. Remember, anti-snake venom in India, what we are using, no, this is effective against all 4, cobra, rat, Russell viper, 𝗬cie𝗂𝗽𝗆, all 4. Okay. Most important line of management is what? Immobilization. 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 After that, anti-snake venom. Remember, anti-snake venom is made up of horse serum. So there is very high risk of reaction, anaphylactic reaction, right? So anti-snake venom is given along with adrenaline injection. Adrenaline injection. Along with this, you are giving one more injection that is called a 𝗬𝗃𝗔. 𝗬𝗃𝗔 injection. Remember, 𝗬𝗃𝗔 injection is given for the, see, remember here, 𝗬𝗃𝗔 injection is given to reverse neuroparalysis. Remember, 𝗬𝗃𝗔 injection is effective against cobra, but not against rat. याद रखना ये सारे points. Fine, no? Anti-snake venom plus adrenaline injection plus 𝗬𝗃𝗔 IV injection. Remember all these points. But for anti-snake venom, most important thing is that look for the local symptoms. Local symptoms are increasing, then you have to give. Local symptoms are decreasing, no need of anti-snake venom. Okay, no need of anti-snake venom. Remember all these points. So in this condition, okay, I know, suppose the local symptoms, systemic symptoms, blood pressure, pulse rate, these are increasing, you have to give ASV. These symptoms are not increasing, no need of anti-snake venom. Very easy to understand. Please remember all these points. Anti-snake venom, snake is always an important topic. See, like they can ask you, what about a scorpion bite? What about a scorpion bite? See, a scorpion bite. Yes, there will be, see, how to differentiate a scorpion and the snake bite? A scorpion bite, there will be up to 2 puncture marks. A scorpion bite, only 1 puncture mark. 1 puncture mark. scorpion bite, one puncture mark. Okay, there will be a stimulation of sympathetic, sympathetic nervous system. There can be, like autonomic storm. Because of that, there can be what pulmonary edema, like all symptoms like that. How to help? First of all, you have to give injection, 𝗏𝗚𝗃. First medicine to be used in scorpion bite is what? 𝗏𝗚𝗃, alpha blocker here, right up. So 𝗏𝗚𝗃, what is happening here? Remember here, yes, very, very important, 𝗏𝗚𝗃. Apart from that, yes, a scorpion anti-venom if it is available. Okay, 𝗏𝗚𝗃. So snake bite, scorpion bite, important. After that, in the plant poison, dhatura plant is very important. See, remember here, examiner can ask you either dhatura poison or organophosphate poison. Always remember that in dhatura poison, all symptoms will be dry mouth, dry skin, dry face, dilated pupils. Patient can go in, there can be dysphagia, right? No, dysphagia, delirium and coma and death. Everything will be dry, dhatura. OP poison, everything, all symptoms will be wet. All symptoms will be wet. Okay, no? Lacrimation, urination, sweating, diarrhea. Okay, like agriculture poison or pesticides, organophosphate poison. So for dhatura poison, what do you use for dhatura poison? Physostigmine. For OP poison, what do you use? All pralidoxymanol, atropine, and the pralidoxim, right? So this is dhatura plant. Dhatura plant, right? What is the active ingredient of dhatura plant? Hyoscine. Scopolamine, atropine. Okay, remember here. Okay, see, remember here. This is the active ingredient of dhatura plant. Dhatura plant is also called as roadside poison or railway side poison, right? Before robbery, before kidnapping, dhatura plant can be used. Easy to understand? Tetrahydrocannabinol. Where do you see tetrahydrocannabinol? Tetrahydrocannabinol. Where do you see THC in cannabis, right? No, cannabis. Easy to understand? Remember all these points. Some important IPCs which you should not be missing. Some important IPCs, please remember IPC number 84, McNaughton's rule. Right or wrong test. IPC 84, very, very important. If an insane person commits any crime, there will be no punishment. Okay, fine. Okay, now IPC number related to IPC number 300, IPC number 302. This defines murder. This defines punishment for the murder. Okay. IPC number 320, grievous hurt. Grievous hurt. Grievous hurt. And some other IPCs I already have mentioned, like related to rape, related to dowry, and related to perjury. Okay, related to perjury, very, very important. See here, remember here, related to IPC number 312 to 316. Remember, this is related to abortion. Abortion. Okay, fine. So, and 191, 193 related to perjury, Okay. And see, like in a case of emergency, doctor can operate even without the consent if there is no one and all. So IPC number 92, in a case of emergency, doctor can operate without the consent. Okay, fine. So I think I have covered almost each and every aspect of the forensic medicine. Suppose if you have done it before, I would say this is more than enough. Okay, this is more than enough. Okay, I hope you had a good revision. I have taken more than 5 hours, but I'm telling you, like other people, like if you are going to, if you are going to see it again, you can increase the speed and you can finish it very fast. Fine. So this is more than enough to solve almost all the questions of forensic medicine and toxicology. So chalo then, and I wish you all the best. You people have done great job so far. You have learned a lot right now. See, I would suggest all of you don't miss short subjects: psychiatry, forensic, radio, ortho, anesthesia, skin. Okay, don't miss ENT, ophtha, pathology, surgery, obs, gynae, PSM. Okay, so yes, chalo then, all the best and thank you so much. Okay, thank you so much. Thank you so much. Chalo then. Okay, good night. Good night. Okay, this PPT will be shared. Okay. Thank you. Okay, then I'm signing off. Thank you. Bye-bye.